Alrighty. So thanks everybody for taking time from your busy schedules to meet today. The COVID-19 pandemic has introduced many challenges to our lives and helped evolve the meaning of EAP. Today we present to you TelusHealth's Life Journey virtual health and wellness platform designed for today's employee work environment and climate. As a couple housekeeping items before we begin, I'd like to kindly mention that this webinar is being recorded for those who are unable to attend. Throughout the presentation, please feel free to message in the Q&A feature if you have any questions. In addition, we'll allocate some time at the end for question and answers, where you may either ask a question in the chat or raise hand functionality. We'll select to unmute you or ask questions. My name is Megan Cole. I'm VP of Product and Solutions here at SEB Administrative Services. Along with me today, we have Patricia Dorn, Director of Marketing at TelusHealth Virtual Care. Patricia holds an MBA and has been working in the field of IT in the US, Europe, and Canada for over 25 years. And we also have Rowie Ben Eli, who is the Director of Mental Health at TelusHealth. Rowie also holds an RA degree and has gained many valuable years of experience in mental health within the medical community prior to joining TelusHealth. So here at SEB Administrative Services, we really focus on delivering solutions that address industry gaps. So that means taking complex business processes and converting them to streamlined digital workflows that really focus on that end user experience. Our suite of solutions along the left is a great representation of how we've responded to changing market dynamics and the challenges that these bring. So when the pandemic became a reality over a year ago, we knew it'd be important to continue to listen to our clients, our colleagues, ourselves, and understand what changes would be experienced and how we could better support. What became apparent early on was the burden that people would feel from the constant change, worrying about family members and their health, changing dynamics at home, everyone under one roof, all at the same time. So it's not surprising that we see stats like these that show that significant increase in depression, anxiety, and insomnia. And we can see that these direct results have an impact on workplace productivity and engagement. So it's easy to see why employers and plan sponsors are looking for better ways to improve the mental health care offerings and really reevaluating their benefit plans as a whole. So seeing this need for better mental health and employee support continue to increase, we really wanted to understand what are the barriers. We know that employees are feeling burnt out from COVID. Remembering multiple passwords and sites and navigating different programs to get support really just adds to that overall burden. So access to these services and programs absolutely needs to be effortless for employees. We also know that the impacts of COVID are wide-ranging. So in order to provide effective support for employees, we need a solution that delivers a wealth of services with one integrated virtual experience that can be personalized to their needs. And providing best-in-class support is great, but it also needs to be affordable. Services need to be harmonized, leveraging the group plans to reduce additional fees, like paramedical expenses. And so it was evident to us that if we could tackle these challenges, we'd ultimately remove the burden for employees and plan sponsors to get better overall access to employee and mental health support. So with this in mind, we've partnered with TelusHealth to develop Life Journey. It's fully integrated into our Flex Plus suite of solutions, and Life Journey brings a fully integrated digital experience to a wide array of employee assistant and mental health programs. With one front door in, employees can easily unlock the value of comprehensive coverage. And we'd love to tell you more about it. Over to you, Patricia.
Thank you, Megan. So what's really the value of TelusHealth virtual care? I think it's important to understand that it's Akira by TelusHealth and EQ Care coming all together. And with that, we're servicing over 2.8 million Canadians with one single mission, which is to help Canadians, all global citizens, to live a healthier life. And this is where we're coming through with four main elements. We've invested over TelusHealth Virtual Care has invested over $3.2 billion for the past 10 years to really revolutionize healthcare. These four elements are, and this is really what differentiates us, a human approach to care. What do we mean by that? We mean that we have a style, a way to deliver a human touch at every part, every step at the journey that you're taking. It's a compassionate approach. It's where we care and where you're at the center of everything we do. We take a long-term approach to things. We're not only look at your problem today, but we'll look at chronic care disease. We look at disability management. We look at leveraging decades of experience that we've built up, actually over 30 years of experience. And we are part of the broader TELUS ecosystem. It means that if you need EMR, if you need access to the 15 clinics that we have, if you need some home health monitoring of chronic disease, or even access to virtual pharmacy, this is enabled thanks to our large ecosystem. And not least, for you, we are one truly integrated platform with one access. And this is where SEB will offer you exactly the same offer. So one access to all your needs, life journey, other solution, everything is on the platform. Next slide, please. Thank you. So I don't want to stop here and look and analyze, because we all gone through it, the different waves. What is important for us to understand is that we're still in it. For sure, we're not yet out of it. And that this concept of virtual healthcare is now becoming a way of living. It's the elements of value that was added to every human life that is now becoming critical. And it's going to be hard to go back to normality. But yet, virtual healthcare will be part of it. So we're looking at probably improving our services, I would say, to look at how can we enable chronic management disease as well with one platform. How can we look at work-life related accidents? What's the overall basic of prevention on mental health care? And we will look at that. This is becoming alarming. And really providing this one front platform for with different needs, servicing different needs. One of the examples I always bring is the frontliner, how we can support the frontliner. It's really critical that we support the employees, but we also act according to niche audience and their respective needs. So it's still a very bumpy road ahead of us, but we're here and we're getting geared up to help. Next slide. So where are we from an employee perspective? Well, these numbers and these statistics from KPMG showed it all. We working is way too much. I mean, in some instances, 49%, so that's high, say they're on the verge of burnout. And I guess we've all experienced, work from home, the kids and the rest. It's hard to maintain this balance. It's really hard. So as a direct result of that, Canadians are facing mental health issues, and the mental health overall is declining, and we've seen it. Probably every other 2 days, there's an article about it, and it's something alarming. And even more alarming is that they're not seeking help. Help is hard to get. I mean, if you ever contact any kind of mental health support, they overloaded, overwhelmed, so it's hard to get. And this is where we can help. This is where we feel we have a role to play. So it's interesting to see that, interesting, it's dramatic, I would say, to see that employees are struggling and that they need help. Let's look at how we can help them. They value work-life balance, again, not surprising, but even more true now. We need to balance our life. And I guess since a lot of us will keep on working from home, this will be something very critical. On the benefits, they're saying that it's a very important value for their work to have some healthcare benefits associated with that. And it's interesting to look at the fact that part of these health benefits is really virtual care, is really care online, because they know how easy it is to get online, to get someone compassionate that walk you through all the different steps, rather than sometime, wait at the doctor. And I'm not saying it's replacing, obviously, but saying it's a nice added value and a nice complement. And it shows. If we go to my next slide, numbers have really proven, and they're mimicking the trends that we're seeing in the US, 250% Canadian growth in virtual care. This is huge, and it will continue on growing. And even more importantly, what you can see is that 9 out of 10 employers say that their virtual care will continue after the pandemic. So this is meant to stay. As I say, looking back into my first slide, this is more than just a concept. It is a way of living. Virtual healthcare is part of our everyday life, and your employee wants it. So let's see with Roy how we can enable that. Roy, over to you.
Thank you, Patricia. Appreciate that. So, what we wanted to give you a little more information about what the difference is between Life Journey and a standard EAP, the traditional EAP program. And a lot of it has to do, like Patricia was saying, the human touch. Well, what does human touch look like? It's not a chat bot. These are what we call our care advocates. These are trained professionals. These are the social workers, nurses, therapists that are there to receive the employee, make sure that they're getting a proper intake, a proper assessment, and that they're getting the care that they need, and that they're directed towards the care that they need. It is not a dispatch service. We deliver that care all under one roof through one front door. It is a preventative and proactive solution. Your employees don't have to come on only when they're having a problem. They can come on early on. They can get advice. They can get counseling. They can get support. And so it's also, and we're also there for chronic illnesses and chronic situations. Like Patricia was saying, chronic disease management is where we're going as well. So that it's not just a one, come on and get what you need and leave. It is a continuous support system, which is an important factor, as well as the fact that it's integrated with existing health and well-being services. There's services internally. We have everything a traditional EAP has and more. So when we go into the value proposition, like we said, that it's care-centric. It is their guidance by a care advocate, which, like I said, are well-trained professionals that are there to support and to assess and make sure that the proper care is given, and sometimes to find the care that the employee doesn't even know they need. They may be coming on for one specific need. However, our care advocates may identify additional needs that the immediate concern did not address, and that is really how we're proactive and preventative and more supportive than a standard EAP offering. Very convenient, available French and English, Canada-wide, 24/7. It is centralized. All our plans are in one location, one profile, and as Megan and Patricia mentioned, through the SEB single access point, and so therefore they don't have to go with multiple passwords and make it, just more complex. Care has to be easy. The obstacles need to be removed, because when somebody's in a difficult situation, the last thing you want is to add more hoops to jump through. So this removes those limitations. It's collaborative. When we say collaborative, it's not just collaborative internally, it's also collaborative externally. If employers or plan sponsors have existing solutions and resources, we're able to plug into those and refer to those. Our goal is not to replace what you already have that you're happy with, but to work with those solutions. And if you don't have them, then we're here to offer solutions that you may not have yet and may want down the road, which include disability management and other type of integrated solutions that really ensure that your employees are getting a single experience and they're not having to go through multiple steps and multiple resources. And that's where the cost saving comes into play, is the fact that we will optimize what is already available. And if you need other services, our goal is always to provide an integrated service, which translates into cost savings, not just on the management of a case and the management of the care and the wellness of the employees, but also in the utilization, the optimization of what's already existing within what you're already paying for. So the plan sponsor value, the return on investment, people always want to know where that is. Well, increased productivity, and that's really presenteeism, is something that we've been hearing more and more about, and the cost of having a workforce that's that's there physically, but not there necessarily in awareness and mentally and cognitively. And these type of programs allow for presenteeism to be increased just by the fact that the self-esteem of the employee, the fact that they're being cared for and know that they have access to all these tools really increases their productivity, knowing they're cared for. But it also increases their productive time because they're not spending time in waiting rooms. They only have one point of access that is guiding them throughout their journey and guiding them throughout their needs, which saves a lot of time and peace of mind. The increased resilience that you get when your employees are well managed and cared for in a preventative and proactive manner is that they don't usually go as deep into an illness or deep into a difficult situation as they would if they had no support system. Here they have the support, which helps get your employees and your workforce through a difficult time. The pandemic was a very good example, but that type of resilience is important either in a transition or any changes that occur, and we're faced with change every day. What we do know is change is, inevitable, and therefore the resilient workforce is an important part of the puzzle. And then the reduced financial stress when employees don't have to pay out of pocket. We know that stigma and out-of-pocket expenses are definitely obstacles to care. Like Patricia indicated earlier, the statistics show that people are not searching out care, and when they are, they're not necessarily accessing them the way they should. So taking away the obstacle of having to pay money in advance is a very good way to increase the utilization and making sure that they're getting the care that they need. So Life Journey, this is just an example. Like I said, Life Journey has everything that Standard EAP has and more. Primary care, which is prescriptions, referrals, and direct access to primary care. Mental health, huge component, and we see the importance for it, like Patricia was saying, day to day. And Megan also, is sharing a lot of those information, that data, that need for mental health care. We now have guided online therapy, which is asynchronous care. It's modular. Employees can access it 24/7. It is supported by a clinician, therefore it's guided, which really makes a huge difference. And it's something that's accessible, especially in the day where we have especially past the pandemic and working from home, we have everything that's going on at home. We may have kids, we may have family members that we have to address, and the time for therapy is not 9 to 5. It may be only accessible outside of those hours, and an asynchronous model with supportive clinicians is a great solution for those type of environments, and face-to-face counseling. Nutrition, and that's available, and therefore work-life balance, the financial advice and the legal advice, and more coming, additional content and wellness. So this is just the beginning. Our goal is to deliver really more holistic care in a deeper environment. Just to give, for those that think we're, like what you're saying, we're not out of the woods yet. And this is part of the conversation here, is that the campaign launched in Ontario for mental health and addiction organizations, just to show how dire the need is that there's a huge amount of addiction issues. There's substance abuse that occurred more and more during the pandemic, the mental health needs, people that were feeling lonely, anxiety symptoms, even anxiety going back to work. If people are not, haven't yet looked at the fact that going back to the office is a huge anxiety inducing situation. This is where all these programs that we're delivering here can be utilized to better improve and prevent, and therefore support employees post-pandemic back into the office, and then for years to come. I think we're moving into the question period now. Megan, any questions come in through the chat so far?
Yeah, thanks, Rowie. So it looks like we have one question already, and for everybody else on the call, if you'd like to ask a question, please, just as a reminder, use the raise hand feature, or you can type it directly into that Q&A feature that you should see at the bottom of your screen. So we do have a question about how employers are handling and managing the incremental cost of a program like this.
So yeah, I think that's a great question. I think ultimately, when you take a solution like ours in an integrated scenario with SEB and Life Journey and created that program, one, just integrating it, there's savings there. There's also the fact that we do optimize what's already available on the table. So we're not coming in to necessarily replace everything you have. It's to give you what you don't have and then optimize what you do. And that's where there's a lot of savings. So on that end, it's not added on top of everything else. It's really, we're here to make sure that it makes sense and it fits the need, and the savings are also translated, and then they come back to really help really support the program. But ultimately, this shouldn't necessarily cost you more. It should actually cost you less when we put it together. And our recommendation is that you reach out to the SEB team and we can sit down and provide a good assessment of your needs and tell you exactly what you'll be saving at the end of the day.
Awesome. Thanks, Rowie. Are there any other questions from anybody on the call?
You know, Megan, we were on a call earlier this week. Our sales team was on a call, and one of the companies that we were speaking to was really interesting. While we wait for another question, I'll just use this time. And that company was paying for virtual care with another provider. They were paying for a digital CBT solution, again, with a third party. And they were also paying for an EAP program. And ultimately, I think when they were all said and done, they were, you know, quite, when they added them all together, it was above, I think, closer to $12, $13, you know, per PM, per employee per month. And when we came in and, you know, because we have it all integrated, we're coming in below 10 at least. I think it was even less than that, but you know, it depends on the company and the size. So I don't want to promise something I can't without the information. But already there, we're coming in with the solutions integrated at a lower cost. They're already saving money right off the bat for three services that exist all integrated in one. So if companies are worried about budget, especially after the pandemic and the difficulty that presented, you know, financially for many companies, this is not only a better service ultimately and a better wellness solution for your employees, it's also the cost savings are significant, and there's other advantages as well that come with working with, you know, a combined offering like SEB and TelusHealth. So I just want to give a kind of a real example as we're waiting, since it's
yeah, no, that's great, Rowie. Thank you for I think that does help for sure to provide that real life example. We do have a couple more questions that have been in the Q&A. So the first one is that it sounds good. Are we implementing new programs, or are we replacing existing plans as well? So are you implementing new programs? Are you replacing existing plans as well?
I mean, existing plans, and I'm just trying to understand clearly the question. So if you do have an EAP, we can replace it. If you do have a virtual care program, we can replace it. If you have virtual care already and you want us to tack on our Life Journey program, we can. So they can be offered both as a standalone or as a combination. And our goal is really to, like I said, to optimize what's already in your resource pool. You have contracts, but then maybe to honor. You have additional services that you need to discuss. You have a union that may have to approve things. So our goal is to work with every organization to meet their needs and to make sure that we just improve their general wellness. And what comes down the road is, you know, is between those two organizations.
And if I may add, Rowie, I think it's almost as simple as a plug and play. It's very easily done from an IT perspective, because I know this can be sometimes a roadblock for people to see, oh my God, it's going to be a complex migration. It's easily done, and it's, I wouldn't say almost transparent, but it's easy to do. So it's something that can be enabled rapidly and provide great benefits for your employees.
And so we got a clarification in the question, just saying that they were referencing existing EFAP.
Yep. So definitely we can replace existing EFAP or provide virtual care and refer to. We already have a few clients that were already doing that. They have an existing EFAP. They bought the virtual care solution, and our team is referring to their EFAP until we either replace or change. Our goal is, like I said, to work with organizations to optimize what they have already and to bring solutions that they don't have access to at this point.
Awesome. And so another question is, might be early days, however, do you have evidence-based results in reduced healthcare costs, increased productivity from the integrated outcomes?
It's a great question. It is still early days, but I mean, I gave a real example there when it comes to, we know that the reduction or the benefits of an EFAP, but when optimized and utilized above, it's 8 or 10%. That is where you start getting the real benefits of the EAP. What we have seen is because of the inclusion of virtual care, that already boosts utilization That alone, utilization in virtual care is in the 20 to 30% range, which drives already utilization up of an integrated solution. And that usually gets people to feel more comfortable. So you experience it, let's say for, if you come on for your family, or you come on for yourself because of a health issue, for primary care, let's say an ear issue, you try it out for the first time, you start to get comfortable, you then access it, the stigma gets removed, the ease of use gets experienced. And then next time you need to access for a different issue, you do feel more comfortable, the app is there, you hit the button and you're good to go. We also see a higher utilization because it's an app-based solution versus a phone call. You don't have to pick up the phone or look for the number. It's an app on your phone. You hit the button and you're good to go. We've seen increased utilization on that as well. We are putting out some numbers shortly. We look forward to showing the numbers a little more concretely over the next few months. But we're seeing a higher utilization, and we're seeing a good, happy experience, which is also something that we value very much as the real testimonial of the clients that are on it already and benefiting from it.
And so I feel like you're psychic today, Rowie, because the follow-up was any information on utilization percentage. So I feel like you probably answered most of that, and that we'll have more specific numbers to come, but we're seeing really good trends in terms of that utilization increase just by making things more accessible, more efficient.
Absolutely.
And again, to that point, I think utilization, I mean, it's a number, but what you have to have a sense of is, because it's a simple app, and because it's as simple as taking a picture on the spot of, your kids getting a bruise or whatever happened in your life, it's as easy as the app. You send the picture through. Again, restating what I said before, but it's becoming something conceptual, is becoming a way of living. It's becoming part of, I take a picture with my phone, and it's the same way you're doing virtual healthcare. And this is the beauty of the system. It's embedded with your life. It's not cumbersome, and it goes along with the fact that it's being utilized. So it helps a lot boost the utilization.
And we haven't even talked about the mental health aspect of it all, is that a lot of the people, individual that then helps find those resources and plugs you into them really makes an enormous difference. And we've seen a huge drop in just anxiety of utilizing the platform, but also in general well-being, knowing that it's there as a support.
That's awesome. So I think that covers it. We didn't get any new questions. I know we're right at time. So since there's no more questions, what we'll do is just thank everybody for your time today. Again, we really appreciate you taking time. We know people's schedule are busy these days, but we really love to tell you about this great program. So thanks so much.
Thank you. Bye.
Thank you.